Hello, my name is Tracy Ryan. I am a class 28 Frontier grad, and I'm really happy to be talking with everyone today about birth centers and the heart of midwifery. I know that many of you have listened to the stories talking about motivating you to move and answer the call. And birth centers are a singular passion of mine and have been since I heard Kitty Ernst talk when I went to Frontier Bound many, many years ago. So I graduated in 2001, and after graduation, I moved to Denver, Colorado, and I started a home birth practice. And after 5 years of attending births at home, I have always wanted to do the birth center model. And of course, I took how to start a birth center. So, right, I should be prepared to start a birth center, or at least so they say. So I tried it and started Mountain Midwifery Center in the Denver metro area. It quickly grew to be just me, myself, and I, a couple of crazy nurses, and I did everything from the laundry to the scheduling to the prenatal care to catching the babies. And it was a couple of wild and crazy years to hiring 6 midwives, and our volume was approximately 25 to 35 births a month, making it one of the larger birth centers in the US. After my stint at Mountain Midwifery Center, I also practiced in a large public hospital, Denver Health, and enjoyed teaching residents and attending mothers who spoke many, many languages. I had a great time there. And then my friend and colleague, Kara Osborne, called me up and asked if I wanted to start birth centers around the country in this crazy new business called Baby and Company. And I actually, at the first phone call, I told her, no thanks, Kara, I'm going to yoga. And I hung up on her. And Kara Osborne is very persistent. So she called me back and convinced me that we could change the world by building birth centers all over the country. So I spent the next year with Kara and team doing the crazy job of growing and starting 5 birth centers across the country. 1 in Arkansas, 2 in North Carolina, 1 in Nashville, Tennessee, and then 1 in the Denver metro area. I am currently the lead midwife in Baby and Company Wheat Ridge, because instead of doing the administrative work at Baby and Company, which I still have my hands in, I love to catch babies and I love to precept students. And I believe that we need more birth center midwives. So I'm going to try and persuade you to answer the call and realize that even if you never step foot as a practicing midwife in the birth center model, all of us, regardless of our setting, need to recognize that the birth center is the midwife's house. It is our heart, and we all must take care of our heart for the entire body of midwifery to thrive. So the heart of midwifery, the birth center model. And of course, I know many of you watching this share my passion for birth centers and maybe have taken how to start a birth center as a class, or maybe we'll be doing that soon. All right, so birth centers. I was thinking about the importance of birth centers a few weeks ago, actually, and how I could connect the body of midwifery and all of the places that midwives practice to the birth center model. And as you can see from my Venn diagram, that, you know, yes, there's the birth center model as a place of practice, there's hospital and clinic birth services, and then there's also home birth. And I would argue that hospital birth represents our mind in the midwifery model, home birth represents the soul, and birth center births being the midwife's house. Home is where the heart is. And so instead of being home birth being the heart, I would say our home is in the midwife's house, the birth center. And just a little diagram about heart, mind, and soul making up the body of the totality of midwifery practice. So in the hospital-based practice, that is where our evidence-based practices are brought to light. That is where we educate many of our new midwives in large academic settings. This is where we mesh with the medical obstetrical model, and that's where we collaborate with it. And this is where we're, as midwives, really fighting for the appropriate use of technology, because in this setting, technology is everywhere. And of course, Kitty would say that the hospital is the doctor's house. And so my midwife sisters that are working in the doctor's house have to fight to rearrange the cupboards, so to say. And the wonderful thing about this model, and I support my midwives and friends that work in this model, is that it has the power to change public health outcomes. It changes epidemiology. It changes the system on a large scale, and that is important to women and families. I would argue that home birth is where the soul of midwifery lives. Women have been giving birth at home for millennia. This is where we maintain our true roots of being with woman and understanding autonomy and self-determination. This is the mother's house. She is ultimately in charge of her health and in charge of her setting. We are guests in that model. The greatest privilege of a human life is to become a midwife to the birth of the soul, says John O'Donohue, a wonderful poet. And I believe as midwives, we are present to that miracle throughout our entire careers, even if we aren't actually actively catching babies. This is also in the home birth setting where we have a deep understanding that birth occurs in the context of a family, and we cannot take it outside of that context. And also, this is where we really have an acute realization of the lack of control of natural processes. In obstetrics, I think control it's a myth. We think that sometimes because of our incredible technology that we can control outcomes, and actually we can't. It is the natural process that is strong, and we have to respect that natural process. And the beautiful thing about home birth is this is where the midwife is able to impact an individual woman's experience. And that is really important. As I've moved through my own career, everything from home birth to birth center to administration, and now back into the birth center, I had to recognize in myself, even in my desire to change systems and change the face of maternity care in our country, that an individual woman's experience is just as valid, and that actually has power as well. Birth centers, my favorite. Birth center practices are where evidence-based care meets families and meets culture. In the midwife's house, we welcome all comers, and we treat all families with respect. The beautiful thing about the birth center model is we are within the healthcare system. We are not outside of it. We have deep collaboration and referral networks that we utilize within this system to make sure, as much as we can make sure of anything, that moms and babies stay safe. And it truly is the midwife's house. I have all of my equipment in the dressers. I know exactly where it's at. I know how the house is cleaned. I feel comfortable in my setting, and that allows me to take care of women. The wonderful thing about this model is it's time, relationship, and education intensive care. When I do a clinic day, I don't have to worry in this model about trying to see 27 women in that day. I see 9. Maybe on a crazy busy day, I would see 12. There are times where a new OB is routinely given an hour to get a good history, to do a physical, to form a relationship. Return OB visits are 30 minutes. We have time to, of course, check her belly, draw labs, but then we have time for education and finding out what's important to that woman and helping her maximize her wellness. And the beautiful thing about this relationship is it's egalitarian. I can meet her on her terms, and I understand that in the birth center, she does have autonomy, and I allow her choices, and I respect her choices. And the birth center has the power to change our maternity care system. I will be talking about what we're trying to do at Baby and Company, but when we're at a place where we have 50 birth centers in a few years, that will impact healthcare systems. And of course, we need more midwives to staff those birth centers. So many of you know recently that ACOG and the Society for Maternal Fetal Medicine talked about levels of maternity care. Birth centers provide peripartum care to low-risk women with uncomplicated, single baby, term pregnancies with no anticipated complications. Cesarean deliveries and operative vaginal deliveries are not offered at birth centers, thank goodness. This is when I like to say to women, this is where a woman experiencing a normal, healthy pregnancy, carrying one head down, normal, healthy baby, wants to come for a low intervention birth. And that is what she gets. We are her birth plan. There is no fighting any system. There is no nursery to take a baby to. Is it safe? Kara Osborne was the lead author on the recent study from a couple of years ago, Outcomes of Care in Birth Centers, a demonstration of a durable model. And in this study, greater than 15,000 women were planning a birth center birth at the onset of labor. Out of those 15,000 plus, 93% experienced a spontaneous vaginal birth, regardless of where they ultimately gave birth. So if we're just talking about a reduction in cesarean birth rates, the birth center model has the power to change large numbers of maternity incidents. Currently, throughout all of Baby and Company, the average cesarean section rate is 6%. And we are all very proud of that. And that's a normal number among the 300 plus birth centers that currently exist in this country. Also in this study, 84% of women planning a birth center birth at the onset of labor gave birth there. 2.5% of mothers or newborns requiring transfer to the hospital after birth. Emergent transfers in the birth center model are rare. It doesn't mean that we don't do them. It doesn't mean that we don't call an ambulance, but 2% of all women or babies that are admitted to the birth center will require an emergent transfer requiring an ambulance. And also in the study, there were no maternal deaths. The interpartum fetal mortality rate for women who were admitted to the birth center in labor was 0.47 per 1,000. The neonatal mortality rate was 0.4 per 1,000, and that excludes anomalies. So exceedingly safe for low-risk women and low-risk babies to receive care in this model. In fact, safer than many hospitals. So how do we do things at Baby and Company? And definitely know this, many birth centers look just like this as well. What Baby and Company is trying to do is standardize the model of care and take all of the administrative aspects that make birth centers difficult for, usually it's that entrepreneur who has leveraged her life savings or her children's college funds to start up this model out of passion. Baby and Company is trying to build places where midwives can be midwives and take that administrative portion and pull that into a standardized model. Also, the beautiful thing about Baby and Company Wheat Ridge as a midwife is that I could walk into Baby and Company Nashville, reach in the third drawer of the dresser, and I know I will find non-sterile gloves in that drawer. We're even standardizing where things live. So if I need to go to Nashville to fill in for a maternity leave, then I know exactly where everything is in the birth room. Our electronic medical record is exactly the same across all centers. And the model, what we're doing at the new OB, what we're doing in our group care visits is exactly the same. So standardizing the model means that midwives can work in many different locations without increased training. So what do we do at Baby and Company? Nurse-Midwives is our only care provider in the model. We also utilize nurses to help and assist with group visits and also in some prenatal care visits. Of course, we are available 24/7 and by appointment. We do early discharge with our moms and babies. Most of our moms and babies go home between 4 and 12 hours, depending on their GBS status, depending on how their early postpartum course was accomplished. And the first thing we do before we go into any market is tight integration with hospital partners. We go in, and unless we have a tight relationship with hospital partners and consulting physicians, and in many cases, especially here in Wheat Ridge, in Nashville, we do midwife to midwife transfers. So our consulting physicians and our consulting nurse midwives that work in the hospital receive women in labor. And it's beautiful for clients to receive midwifery care even when they need to go to the next level of care based on their condition. We also offer prenatal yoga, nutritional counseling, massage, group care, childbirth education, breastfeeding education, and a small retail selection to help and assist moms and newborns. All of this in a beautiful setting. I like to say it looks like having your baby at Pottery Barn, and it's gorgeous. And of course, one of the big things for this model as we grow the model is that this care can be delivered at 50% of the cost of a vaginal birth in the hospital. So if we start talking about 50 birth centers across the country, and each of those birth centers doing between 300 to 400 births per year, the savings in the reduction in cesarean birth alone, and then if we're thinking about how much families are spending for vaginal births, is tremendous and will impact our system. So transfers of care, those of you who have not worked in a birth center setting or don't know very much about the birth center setting, I always get questions about transfers. So in the birth center study that I quoted a few slides back, approximately 12% of women that are admitted to the birth center in labor require transfer to the hospital in labor. The vast majority of those transfers are non-emergent, 98%, and the majority of those are for protracted labor. I like to say it's the primip stuck at 7 with a malpositioned baby. Emergent transfers are infrequent, less than 2%. Majority are for non-reassuring changes in fetal heart tones. So in the birth center setting, we do have access to IV fluids. We do stock Pitocin, Methergin, and Cytotec for postpartum hemorrhage. We do have terbutaline in case of seeing these non-reassuring fetal heart rate changes. We can stop labor for 20 minutes and get ourselves 0.2 miles across the street to the hospital. Newborn transfers are infrequent. Here in Colorado, where Denver is at a mile high, the most likely reason for transfer is transient tachypnea of the newborn, TTN. And and that is across the country as well. Most of those babies are home within 48 hours. Out of the newborns that require emergent transfer, very few of those are for a baby that, you know, is unstable. We just need to get that baby to the NICU quickly. Most of the time we are transferring to hospital-based CNMs. Some of our birth centers, our midwives have hospital privileges depending on the setting and just the midwifery environment that we have started this birth center in. And that's wonderful because it gives the client access to the midwifery model, even if they need to go into that hospital setting. And also, I would say transferring care sometimes to our home birth nurse midwives, especially here in Denver, strengthens community support for the birth center model and normalizes childbirth. I like to say a rising tide floats all boats. It's not that we're competing with our hospital-based midwife colleagues. It's more and more women are choosing midwives. And depending on where that woman feels comfortable, there are plenty of women having babies to go around. Not all women want to be in the birth center setting. Not all women want to be at home, and not all women want to be in a hospital. So all of us successfully working together and advocating for each other. There are many times where I will refer families to hospital-based midwifery care who just don't seem comfortable in this model. And I would advocate that as midwives, we need to take care of the heart. Without the heart, the mind and the soul don't exist. Even though less than 2% of all births occur outside the hospital, I remember 10 years ago, that number used to be less than 1%. And so birth centers are growing. Women are choosing to give birth in this model for safety reasons, for financial reasons, and for comfort reasons. And so all nurse midwives should take care of the heart and promote birth centers nationwide and in your community if you're lucky enough to have a birth center in your community. Because that healthy heart will keep the mind and the soul strong. I would recommend that you spend time in your local birth center. I always tell hospital-based colleagues, you are always welcome to come and observe a birth with me, go on a tour, find out more about birth centers and what we do so you can be educated. Joining the American Association of Birth Centers, it's a great way to stay connected to what's happening in the birth center world. And I can tell you that in the last 6 to 7 years, there's been an increase of 100 birth centers around the country, from roughly 200 to now over 300. So this model is growing. And if you don't know what's happening in the model, you might be amazed at what we're able to accomplish. If you work with student nurse midwives, please encourage student nurse midwives to gain clinical knowledge in a birth center. We absolutely take students, and of course we absolutely love frontier students because we are steeped in the birth center model from the time we step foot in Hayden. Please ask your birth centers if they can take a student because it will change your practice forever. And midwives, current midwives, please consider working in a birth center as a nurse midwife. Baby and Company's planning to grow to 50 birth centers by 2019. We need more midwives, and we need more midwives who want to do hands and knees water birth by candlelight. And I will tell you, there's no greater joy than to attend a woman in that situation. So babyandcompany.com might be a great place to start. We have openings in our centers. Thank you for your time and attention. And I hope I've given you a little bit of an overview about birth centers on the whole, the safety in birth centers, and why we need to take care of the heart of midwifery. Now get moving. Let's change maternity care.